Thank you for sticking around for this part. It's really important. I was going to talk a little bit today about the work that we do at the Information Futures Lab at the School of Public Health. Just to give you a quick overview, we research information challenges and how they impact health and well-being, including the impact of climate change on health. This is a recent publication about COVID-19 misinformation interventions and what we can learn from them more broadly. We co-create solutions and pilot and support innovators. So we have a fellowship in our program. We just announced our latest crop of innovators. And we provide technical assistance to communities, and we do all our work in partnership with communities. And I will talk a little bit more about what these different things are. So today, I wanted to talk about 4 things. 1, the information crisis that we're in. 2, why misinformation is not the only challenge that we face when we talk about climate and health communications, and why more facts are not the answer. How we can move past one-way messaging strategies, and why we need to start talking about the impact of climate change on health now, everywhere, all the time. I'll preview a little bit of the latest research. You're going to be the first to see it, so I'm excited to share. So people often think we live in a misinformation crisis, but I'm going to try to convince you today that we don't. We live in an information crisis. And that's an important distinction, because the challenges that we face are so much bigger than misinformation, and mis and disinformation often feeds off what is missing in our overall information ecosystems. So we all know that technology is rapidly changing, and AI is just the latest in the batch here. Seeing used to be believing. All of a sudden, we're trying to educate each other very, very quickly that seeing might no longer be believing. And any, sort of deep fake video you might see may or may not be produced by the person who you're actually seeing, or authorized at least. And we've seen a lot of negative examples of that, but we've also seen positive examples where somebody in prison couldn't be speaking, and there was an authorized AI version of the person speaking. So tricky questions. Things are changing quickly, and so are our information consumption habits. So how many of you in the room here are on Facebook? How many of you are on TikTok? So generational differences immediately become available here. We all have a different information diet. And what has also happened, especially after the pandemic, is that we have very few guardrails. We're all driving Ferraris right now on our smartphones, but there are very few seatbelts, no airbags, no rules of the road, none of that stuff. So also we have this explosion of content. There's just stuff everywhere all the time. And what these types of changes mean, since none of us is this guy, is that people have more information needs. They have questions. It's become increasingly hard. Some of us are old enough to remember both before the internet and also how early in the internet you could actually find information pretty quickly, and it was awesome. Right now we have the opposite of that. We have a lot of chaos. And that means that people have more questions, that we have increased information inequities, and people are more vulnerable to mis and disinformation. So you're going to see some gifts today. It's a communications talk. So a lot of the work right now in our field in information integrity focuses on misinformation, but we argue that we also need to put a strong focus on people's concerns, questions, and confusions. And I'm going to walk you through what that means for climate and health communication. So if you spend time on the internet, people have a ton of questions all the time. And they go to Twitter and other social media platforms to ask these types of questions. We have yet to build the right ways to respond and be active in those places. We just did a pilot in South Florida where we work with trusted community leaders to share with us questions that the community is asking every week. And this was broad, and I'll explain later why it's important to not just come in with your single issue. So we asked them, tell us any questions people are asking. Florida had just implemented a new open carry law, so there were a lot of questions around safety. But you can see that there's a consistent trickle of questions around climate change, and it's elevated obviously when active climate change events are happening. So what questions are people asking? Is climate change happening? People say it's not caused by humans. Will there be more floods like the ones we just had, and are they bad for health? We did this pilot with Spanish-speaking diaspora communities who got a lot of their information through WhatsApp and from family members all over the world, especially in Latin America. And very often they don't necessarily understand, for example, the US healthcare system, how all of that works, or how does the insurance system work. And you may know, for those of you who work in environment, that insurance companies, all but two, have left the state because it's too expensive to insure, given that Florida is on the front lines of climate change in the United States. So people are left to their own devices there. And questions like, is there now plastic in the clouds, and is this bad for people? So people have a lot of questions. Number 2. Misinformation is not the only or the biggest health communications challenge that we face when it comes to climate and health communications. These outdated communications practices that I mentioned and will walk us through a little bit more now are equally harmful. So when authorities and experts communicate in today's world, it is too often top-down. It is linear, and it is about traditional ideas about expertise. Who here is familiar with the deficit model? I see no hands, a little bit up there. So one of the most striking things is that experts and scientists are also human beings. And as human beings, a lot of experts and scientists do not actually consider the behavioral health sciences when it comes to communication. So the deficit model means that I'm the expert. I'm here to tell you all the things, and you're here to receive the information. You are the recipients. There's a gap, there's a deficit, a knowledge deficit that you have. There's no feedback loops. And more facts are the answer within this model. But how do we as human beings work? And by the way, how do our online information and in general our information spaces work? They're dynamic, they're organized, they're participatory. People exchange information with each other all the time. And expertise doesn't just come from what some people have studied, it also comes from experience. People exchange their experiences. And they feel they're heard and have agency. When I'm being lectured to, I might be super curious, or I'm a brown nerd and I love it, but most people do not respond well. When you go to the party and you keep, repeating a number of facts, people are going to walk over and have a beer with somebody else. This is how we need to think about how we communicate and engage. And we need to recognize that our relationship with information is emotional. So this is a great example from the climate world. Beautiful visuals, right? A+ for how this was designed and how it's shared online. I learned these facts. What am I supposed to do with them? And now come some of my favorites, and I have so many of them. Right? Going to the office is killing us. It's killing the planet. Our addiction to meat is killing the planet. Is your pet killing the planet? Will climate change kill off humanity? These are all recent headlines. These are all within the last 12 months or so. Climate change kills the mood. Economists warn of less sex on a warmer planet. So, our pets are bad. Now, we're not going to have sex anymore. Of course, climate change killed the aliens, and now it's killing us. And here comes my favorite. We also can't even breathe anymore. So how do you leave with this being in your information ecosystem all the time? Disempowered, and why would you engage? So these are some of these outdated communications practices where people are like, well, whatever, right? And then they're open to other people saying, well, it's not caused by us anyways, and don't give in to those, and I won't go into the language that some people use online. This is one of the examples I just was in my personal experience last fall as we were doing an information ecosystem audit here in Rhode Island about how people talk about climate and health. And in my inbox, obviously I subscribe to everything, right? And I'm an engaged climate citizen, I'm German, so that's what we do. Come to the fossil fuel march. How many people are gonna go to the fossil fuel march versus how people are actually talking about this online? Why are my electricity bills so high? This latest heat wave is really creating a challenge for me. And people may or may not be making the connections to their own health with these types of things, but this is where we can pick people up. So when you're communicating about climate and health, remember a couple of these. Stories are more powerful than random facts. It's always been true, and it is still true. You all are part of the solution. Everybody here has knowledge and experiences to share and can engage with others. And it doesn't, whatever platform you're on or whatever your community you're in, go and engage. Don't use broad terms like climate. Be very specific and address things at the personal level, like we just saw some examples. And avoid these fear-based messages with solutions that seem unobtainable. How can I make the fossil fuel industry do anything? And health is really a fantastic lens for us to do this work because it impacts people's lives directly, and that is something that we can talk about. And then obviously avoid the lecturing. People don't have to understand the science of climate change to act on what they can do. That's a different question. People might want to understand how climate change works or not, but that's irrelevant for making choices in your own community. When we worked with people on the electricity bills, we helped them connect them with support to pay, but then also explain to them that they have choices, depending on what state you're in, that you can change where you get your energy from, and that can have a longer term impact. So connecting these elements is really important. And lead with empathy always. This is an example from vaccines because I love it so much. When, you all know Nicki Minaj, and when she was thinking about going to the Met Gala during the pandemic, she was like, well, they want me to get vaccinated. Why should I do this? I'm not really sure. I'm thinking about it. And who here knows Kevin Kruse? You don't. Okay, Kevin Kruse is a really fantastic historian. He's part of the 1619 Project. He's a brilliant man. But like many others, he got a little elevated throughout the pandemic trying to explain things. And I'm not calling this out, this is not about Kevin, it happens to all of us. But don't give in to the snark. Because he's like, what do you mean, right? You have scientists in your basement? Who are you to talk about science? What is that? It's disempowering, it's arrogant, right? And it makes people be defensive and double down. So of course, the wonderful Kizzy, one of the co-inventors of the mRNA vaccine, is like, I emphasize with this sentiment, I want every single person to get vaccinated out of their own informed will. Hey, and also, I could be your med date. So humor and empathy. That's how we want to engage, no matter if it's in person, online, or wherever. Point number 3. We talk a lot about dissemination strategies to get the right messages to people, but that's not the answer. We need to build infrastructures of trust. So what do I mean by that? Who here is familiar with the global health concept of vertical versus horizontal programs? Interesting. So I have a background in global health also, so I was hoping that at a medical school this metaphor could help. But vertical programs are a PEPFAR, let's invest money in fighting HIV and AIDS in Africa. So they come with a specific topic and then engage on that topic more or less only. More complicated than that, but just for the sake of the argument. Horizontal interventions are about a range of issues, not a single disease, and they're prevention focused, driven by the community. So what that means is often when we come with one specific issue, the community is like, well, wait, what? In the pandemic, we descended on Black communities in the US saying, hey, you all need to get vaccinated. Your populations are dying disproportionately. And people said, well, sure, they're also being shot disproportionately. Why all of a sudden do you care? Why are you here now? So what we need in climate and health is horizontal engagement. We need to have a mindset of avoiding to enter with this issue of this is what I care about, so now I come to you and I want you to care about that too. We need to engage holistically and sustainably with communities around how what we care about impacts them and how does it fit into the bigger picture of what is happening in community already. What is important to people, both with respect to the issue that we care about, but also in general, and what are other challenges, and what are the priorities here. So when we did a lot of the vaccination work, it was about how does the vaccine fit into your life? And what is it that we need to address first before we can get to that goal? And then we need to have this commitment to build long-lasting relationships. Communities hold the key to impact. This is just an example. As I was just mentioning, we were working in communities of color in 5 cities in the United States, and while vaccination rates across the country went down, they consistently went up in communities through this effort of holistic engagement. Solutions always have to start with listening. As mentioned, it's available online. A year ago, we did an online information ecosystem assessment here in Rhode Island around how people talk about the topic. But don't ask people to invest in telling you if you're not willing to invest back. What community organizations here in Rhode Island say is like we're over-surveyed and underserved. So we have a lot of researchers in our community here. What we need to do is act upon the answers we get to the questions that we are asking. And this point is also really important, as I mentioned earlier, within this bigger ecosystem where things are chaotic and things are changing rapidly. We're increasingly seeing information inequities. So in our work with communities, we often see that quality information lacks appropriate language and cultural cues. It's designed solely for high-speed internet access. Behind a paywall, it's not in the language spoken, is in places where people don't spend their time. We talk a lot, I'm a journalist by training, we talk a lot about last mile journalism, because increasingly where the quality information from journalism sits is not where people are at all. It's designed for people with varying levels of literacies. The US is like the most diverse country in the nation, but our information ecosystems are not made for that diversity. Delivered by messengers people either don't trust or only a little. So the trust part is really important. And then, of course, there's the whole disinformation, misinformation ecosystem. There's a lot of information out there that's deliberately trying to confuse people. So information is a social determinant of health, and we need to treat it as such. We have this all written up nicely. These are the 12 steps of how to do this work in an engaged and sustained way, and how we build these infrastructures of trust over time. I do think that Rhode Island can be an example for the nation because we have a small enough community to engage holistically across issues. And that brings me to sharing just to finish up a little bit of research that we're doing right now to whet your appetite and see who wants to collaborate with us. So how are the health effects of climate change actually communicated across news and social media? What do we know about that? We received funding from the Rockefeller Foundation to map this landscape. The Rockefeller Foundation has taken a leadership role, investing $1 billion in creating financing models for this work globally, and is keenly aware, that there are some challenges to how we're communicating about climate and health. So to map this landscape, we scraped data in English, German to come, from news headlines on Facebook, from news headlines plus Facebook, Twitter, Instagram, TikTok, and YouTube posts. mentioning climate crisis, climate change, or global warming. And then we looked at this data to identify health-related posts within this larger body of conversations, to understand how frequently do people actually talk about the health impacts, and how much do people engage with this content, and what type of health conversations are we having. So this is very preliminary, as mentioned. We just got the first readout from some of the data. We built a large language model for this type of analysis. So this is just, of course, you end up with millions of posts. Most of the conversations are happening on Facebook. And what we're finding is that within all these sources that I just mentioned, so between news headlines, traditional media, new digital media, and social media, the health effects of climate change make up a very tiny sliver of the conversations that are happening. On average, it's 2.8% of all content across these platforms. This is for the last 13 months. Sorry, between January 2023 and March 2024. And they account on average for 2.5% of engagement. So engagement means is one question is how much is out there, but then the question, of course, is how much are people actually engaging with it and looking at it. Online news has the highest percentage of content mentioning the health effects of climate change. TikTok and Twitter have the smallest. That makes sense. Journalists are covering the impact of climate and health, but it's not so much seeped into the conversations that people are having. And the discourse itself, so now we're within that 2.5%, right? But within those conversations, the hot topics are disease, heat, and mental health. For example, we're seeing a lot of mental health conversations on TikTok, which makes sense as a younger audience, is where that audience's mindset is. And that's it. We have this large data set. We would love to work with people who want to ask the data questions. And of course, I'd be happy to take your questions.
You talk a lot about information, but really the primary goal is behavior change, both individuals and as a society. So you can give the information through various formats, but how you give it, and how that interaction occurs has to get at sort of the model of motivational interviewing almost, right? You have to elicit what's important to them, and it is an iterative and cooperative thing. It's not just putting information into all the channels, but what do you do with the information?
Well, I think that is both right and more complicated, because we often come with a behavior change agenda. I think we need to start with where the people are and where the communities are, because where we want the behavior to go might not be where the community is at. That's number one. We have been over-focused on the behavior change part, and we have overlooked the structural barriers. So that's why I always bring the slide about information as a social determinant of health. Those are the first barriers. The second then is when we talk about how the information is delivered, of course, immediately impacts what information people trust and don't trust. So I didn't talk a lot about trust, but trust is a main precursor of how people make sense of information. And one challenge that we see in our information ecosystem is, excuse me, that experts as well as journalists have not been able to build or keep the trust of a lot of people. So that is a significant barrier. And the other part is that we often, that we need to distinguish between where it's about behavior change and where it is not. I was asked at the Chicago event, why aren't we just telling people to stop using the plastic bottles? Is it the people's responsibility to stop using the plastic bottles, or is it the industry's responsibilities and the advocate or the policy world's responsibility to just outlaw the plastic bottles? So again, it's very easy to pick on the people, and it's much harder to make these other changes. When we do, we see that people follow. Wherever we've done, introduced recycling, people recycle. We just don't know what to do with all the recycling. We haven't prepared for that. So again, while that is, it's really important how people engage with information, and behavioral sciences play an important role here, it's important also to not make that the only focus. Yes?
I guess to that degree, we've heard a lot of discussion today because, there aren't enough studies being done in terms of like microplastics effect on humans. We learned a lot about satellite modeling today. So I'm wondering a little bit in terms of discourse among experts across different fields. What are some of the problems that we have in terms of communicating in that domain, and how do we go about solving those problems?
And you mean communicating amongst each other, or communicating your content with other audiences?
I guess a little bit of both, because there's also the side of, physicians talking to the data scientists, talking to policymakers, and things along that line as well.
Yeah, I think one way to think about that is, and I will say this has always amazed me about America, is that there's a much larger willingness to try to communicate your science. If you can communicate what you're doing really well, that's actually beneficial for your colleagues in those other fields who are also not experts in what you study or what each of us study. So that's the first hurdle. The second one then is to really embrace microlearning. There's often an attitude that people aren't reading enough anymore. And I was trying to read a New York Times story the other day, and now that we have the beautiful, audio version of it, it's a 45-minute audio version. So that's the time that I need to invest in this one piece of story. So embracing smaller formats and not being upset about that, because we engage with information all the time. Content is constant. That's how we learn as human beings. Again, we have this, we work on something for 3 years, and then we write up a beautiful paper or a book, and then we want people to understand it, instantly. And you can see this especially in the TikTok generation, how much they're learning by consuming these videos. They consume more information than any generation before. So I think that's an important part of that, to keep communicating. And also, as human beings, we all miscommunicate every once in a while, which is why the importance is in the conversation. Too often people are alone in these online spaces when they make sense of the information that they're receiving from a news story or from a science talk that they heard too. But then we're no longer there when they're saying wait, what did he say? And can somebody explain this to me? So finding good ways to talk, accessible ways to talk about the work that we do, and then sharing it widely. But being open to questions, being open to, again, it's not a one-way street. It needs to be a constant feedback loop. You have another question?
This is Tanya. I'm just curious, and I know your research is still very new and you're still working on it, but why only less than 5% of all of the posts has to do anything with health? And you also mentioned earlier in the talk that health could be a really important concept of how to personalize climate change. So what do you think that gap is right now in the information?
Oh, yeah, that's a fantastic question. Thank you. So COP28 last November was the first time we had, 100 health ministers? And in all of the COPs before, we had 3, I believe, somewhere in that ballpark. So by and large, we've talked about climate change, not thinking about health. Now, some of us have done this work for the last decade, but that's not where the public is. So in general, I think, while the medical and scientific community is talking a lot about these connections, it hasn't set sort of into the public, especially because we're not making enough of these connections. And part of what we're working on right now, what you can't do with this quantitative analysis is see the proxy conversations. So with our current approach to this research, because we have to start somewhere, I will not find the electricity bill conversation, which is clearly about the health impact of climate change, but I need to know that. So we're working on qualitative parts of this research that helps us better understand all these proxy conversations about wildfire, about asthma and so forth, about emergency room visits that help us make these connections. By and large, like both we as researchers are working on that and have only started recently, and the same is true then for how people talk about it. What was the second part of the question? Okay, excellent. We done? Thank you so much, everyone.